Hey guys, it's Luca here from Peak MSK Physiotherapy. Today we're going to be running through some exercises for nerve pain or sciatica. So these are some great exercises to do during lockdown if you want to maintain or increase your neural tissue mobility. So the things that you will need for this session, we're going to need a chair, obviously. We're going to need a mat, also going to need a bed and a sciatic nerve. So what is the sciatic nerve? So the sciatic nerve is branches of nerves that come off the spinal cord. We talked about the spine and the spinal cord in last session, so if you'd like to look at that video just as a brief introduction, go ahead and click on that video. But basically what the sciatic nerve is it's a nerve that runs through the pelvis, comes out the pelvis, and then runs down our leg before branching off into different nerves. So to give you an understanding, I'll get my elastic band here and we will simulate that. So I'll wrap it around my foot, it will come up my leg and it will go into the pelvis and attach into the back, so something like that. So you can imagine that how you move and how you position your body will affect the movement and how much, I guess, tension, for lack of a better word, is going through that nerve. And we are going to be running through some exercises that will adjust the amount of movement that's going through the nerve in this video and also help with some exercises. We're going to do some exercises that can help reduce some inflammation that may occur. So that's a brief touch on the sciatic nerve. So what about sciatica? So sciatica is the result of nerve irritation in the back, pelvis or buttock. As I touched on before, it goes a long way, the sciatic nerve, so there's lots of points that could irritate it. Sciatica is often associated with radiating pain, weakness or reduced sensation. So how does exercise help with sciatica? So exercise will help improve your muscle strength and joint mobility in your spine and can nourish your spinal discs. Exercise can help to alleviate inflammation, reducing pressure on your sciatic nerve roots. Stretching has also been found in some populations to ease sciatic symptoms by releasing certain muscles that may be provoking the sciatic nerve. So before we get started with the exercises, as always, do these exercises with caution. They're a great one-size-fits-all type of exercise and are based on the best current evidence. However, they may not be suitable for your exact presentation. If your sciatica hurts or hurts more than usual during these exercises, you may benefit from a more tailored program within your abilities. These exercises should not cause prolonged pins and needles or numbness, and if this occurs, do not continue with the exercises and seek advice from a physiotherapist. Another little caution is that sciatic pain is related to compression and stretch, but it's also related to how hyperactive the tissue is, and this is what makes it different to other nerve pain. So with that out of the way, we will get started on some exercises. So we briefly touched on how muscles can play a role in irritating the nerve. So that's the first few exercises that we're going to be doing is some stretches. So the first stretch that we're going to do is for a muscle called the piriformis. There are a few positions that you can do this in. You can do it sitting, you can do it lying down, or you can do it on your stomach. I will run through them all, but we'll start in sitting because I'm sitting. So what you will be doing is crossing your leg over the other one, and this would be if I had symptoms of sciatica in this leg, it would be going on top. And what you'll be doing is leaning forward, and you might already start to feel a stretch. So leaning forward and then using this arm just to push that knee gently down to the point that you start to feel the stretch. So a different angle of that. So crossing my leg across my other leg, leaning forward and gently pushing down. So we'll hold that for 30 seconds. And it is important that it's just a stretch feeling. It's definitely not pain or something unbearable, just a gentle stretch. Okay, so we'll say that's 30 seconds. If you're happy doing it on the chair, then by all means do it on the chair. I'm going to run through another position on the mat where I'll be doing it on my back. So I'll get this guy out the way. So we'll say that my left is still the symptomatic leg, so you may have those symptoms that we described before down that left leg. You'll be on your back again, one leg crossed over the other. Not sure how well you can see that. One leg crossed over the other, and you can bring this leg towards you, and if you're not feeling the stretch, then you can use this elbow to push down on that left knee. And we'll hold that for 30 seconds. Okay, the next stretch that we're going to be doing is we'll be on our front instead of on our back. Again, this is another variation of stretching the same muscle, so if you're finding that you can get a good stretch with either on the chair or on your back, by all means keep doing that. This is a bit more of an aggressive position, this one on your stomach or on your front. So we'll just say, for the ease of it, that my right leg is the one with the symptoms now. So from a 90-degree position, you'll be bringing it inwards, like so. Bringing your left leg back, and then just leaning into that. And again, it's the same principles as the other one, because your leg is at that 90 degrees, the knee is coming towards you, and you're applying that extra stretch. So if you find that you don't feel that level of stretch required with the other stretches, so on the chair or on your back, this might be a bit of extra force required. We'll hold that for 30 seconds. Okay, come out of that. So we'll move on to the next stretch now, which is for another muscle in the hip. This is called the glute med, or gluteus medius for short. So again, there are a few different positions that you can do that in. You can do it in sitting on a chair, which I will run through first. So similar starting point as the other stretch, you'll have one leg crossed across the other one, but instead of pushing, you'll be pulling now. And when you're pulling, it's more of a diagonal direction, so you'll be pulling, I guess, towards the other hip, and you should start to feel a stretch through there, through your glute muscles there. If you want to lean forward, you can lean forward a bit, but I don't need to because I can feel that at the moment through my hip. We'll hold that for 30 seconds. Okay, and relax there. And obviously in that scenario, my left leg would be the symptomatic leg. So again, if for some reason you're not comfortable doing that on a chair, you can also do that on the floor. If you wanted to do it before a run, if you're out in the park or something, or you wanted to do it before sports training, then you can do it on the ground as well. So it is a similar position. So we'll say my left leg is the one with symptoms, crossing my left leg over my right and hugging my left leg. Similar to before, with the direction of the force coming diagonal. You're not pulling straight towards you. We'll hold it for 30 seconds. Okay, so we'll do that one more lot of 30 seconds. I'll change angles just so you can see what's going on from a front direction. So again, the left leg will be crossing over the right if you're having left leg symptoms, and then hugging that knee towards you. You can lean forward a bit if you need to. We'll hold that for 30 seconds. Alright, we'll stop there. So those two stretches, if we have a look at that little sciatic nerve demonstration or model again, if you can imagine coming through here, there are lots of muscles that surround that nerve. If some of them are tighter than the others, they may cause some extra pressure on that nerve. Okay, so the next thing that we are going to be running through, they are called sliders. So just before we get into these, it's important to note that they're a stronger technique and may not suit everyone. So if you have a disc pathology or suspected that you have some disc type of issue, then these aren't the best exercise for you. And they are, so only do these exercises if you've done them before and haven't had a problem. And if you are doing these exercises and you do get any pins and needles or numbness, then stop doing the exercises, and that should settle down the symptoms. But again, if it's not, then seek advice. Okay, so I'll tie that onto my pants there, just so you can keep a image of the sciatic nerve in your head as we're doing this. So we'll run through, you can't really see my foot there. We will run through a few different techniques that will bias different parts of the nerve. So we'll be doing 10 repetitions, and the first one we'll be doing is that they're called sliders for a reason. If you imagine a piece of dental floss So you're going back and forwards. We're going to be doing a similar thing with the nerve. So if you imagine that this continues all the way up to the base of my neck, like the spinal cord does, we'll be going down and up, down and up. We're doing 10 of these. Right, so we'll say that's 10. If you're happy with those, if you're getting good results with those, then you continue to do those. But another way that you can do it is by moving the whole knee instead of just pumping the ankle. So it takes me a while to wrap my head around it myself because it is a whole lot of moving. So if you're struggling, don't feel bad. You'll be kicking out, so putting tension on the nerve, and then going down with your head at the same time. And then as you come back, you'll be bringing your head back up. So going down and up, down and up. Four, 5, 6, 7, 8, 9, 10. Okay, so doing 10 lots, 2 lots of 10, nailed it, is what we'll be aiming for. And an alternative of that would be, if that's too provocative, then you can do it lying on your side. So we'll run through that now. So it's the same movement as before. I'll keep my nerve where it's supposed to be. You'll be going down with your foot, down with your head, and up, down, and up, down, and up. You can have a cushion here if you wanted. I'll allow it. I don't have one. And the same dosage as the other ones, doing 2 lots of 10. Okay. So the next exercise that we'll be doing is the glute bridges. So you might recognize these from the previous video for back pain. If you haven't, then check that one out, but we'll be doing them again because they are a great exercise in general and they're also good for sciatic pain. So we'll run through those. So lying on your back, and you'll be pushing your buttocks towards the ceiling. Again, as we touched on in the last video, not going too high. You don't want to put too much strain through your back. We're going up and down. We'll aim for 10 of those. I'm not going to go into a heap of detail about this because, as I said, we did cover these in the last video, so If you'd like a bit more cueing, then you can check out the other video. If you wanted, you could do a few with the tilts as well. So tilting up and up and relaxing, tilt and up, tilt and up. Alright, so we'll call that 10. We'll have a break and then we'll do another 2 lots of those. Okay, so when you're ready to go again, we're pushing up towards the ceiling and down, up and down. Eight, 9, and one more, 10. Alright, have a rest, grab some water if you need it, and when you're ready, we'll go into another set of 10. Keeping it nice and controlled, not too quick. Nine and 10. Okay. So those are all the exercises in here. We're going to do a quick change of locations and we'll run through some other exercises. So bear with me. Okay, so welcome back. Just a quick change of scenery. So we're going to be running through some exercises that you can do lying down on your bed. So I'll get a pillow. And we will run through the exercises. So you'll be lying on your side for this one with a chair. And in this instance, it will be my left side that has the symptoms. And what you'll be doing is you'll be dropping or shuffling close to the edge of the bed and then dropping your knees and heels over the edge of the bed and laying them down onto a chair. So we'll be doing this for 60 seconds before we come back up for another 60 seconds. And if you are finding this a bit too aggressive, then we can run through an alternative. But otherwise, if this is tolerated well, then you can manage, then you can keep doing this. So again, with all of these exercises, including this one, there should be no pins and needles or numbness occurring during them. And if that is happening, then stop the exercises and seek advice. So we'll say that's 60 seconds. If this in particular is too aggressive for you, what you can do is coming back onto the bed. If it is still left-sided symptoms, you may find just dropping your right side, your right leg, will help provide some relief. If you wanted, you could have a pillow under your left ankle. But if the other type of exercise is working well, then we'll continue doing that. So both legs over, we'll keep it there for 60 seconds. If you do decide to do the other type of exercise with just the one leg over the edge, it's the same time that you leave it over there. So we'll be doing 1 minute down, 1 minute up, and then we'll repeat that 6 times. And then once the 60 seconds has elapsed, bring it back up onto the bed and keeping it there for another 60 seconds before we go down again. So again, we'll say that's been 60 seconds. I don't have a stopwatch on me. So going down for 60 seconds. Again, we'll say it's been 60 seconds. Back up on the bed for 60 seconds. And if you were having right-sided symptoms, obviously it'd be the same, just rolled over onto the other side. But it would be the same type of movement, just your right leg will be on top. Okay, so we'll set 60 seconds, come down again for the 4th lot out of 6, holding it there for 60 seconds. So 60 seconds is up. Back on for 60 seconds. And back down for 60 seconds for our 5th set, our 5th lot. Back up for 60 seconds. And then last lot of 60 seconds, hanging over the edge of the bed. And then back up for 60 seconds. Perfect. I hope you all haven't fallen asleep from that. But we'll go into the next exercise, which will require a foam roller. And you can do this on the ground if you'd like. I'm going to do it on the bed just because it's easier for me. You can do it on your bed if you'd like. But this will be a good position if you find that you do have that sciatic type of pain or symptoms, then this in some people can provide a bit of relief, and you'll have something under your knees. In my case it's a foam roller, in your case it might be a pillow or anything similar, and you'll be rolling your ankles outwards like that, so my knees are facing like so, and you'll just be holding that there. And there's no set amount of time for this exercise, it's just a position that you might find helpful. And if you wanted to, say that you've got left-sided symptoms, you can roll your foot in, go down towards, or point your toes downwards, and then come back up. Point your toes, come back up, and roll back down. Come in, point your toes up, and roll back out. And if you imagine that nerve that I had on before, if you imagine how this type of movement helps to mobilize or move that nerve. Otherwise you can just hang out here. Alrighty. So those are all of the exercises. Thanks for tuning in. These have been some great exercises for sciatica. If you would like to know more or think you need a more in-depth assessment or treatment of your sciatica, send us a message, and be sure to stay tuned for next week's videos on spinal stenosis, or if you would like to check out the previous week's episodes on rotator cuff or back pain, then you can check that out by looking at our previous videos. Alright, thanks for tuning in. Bye.